about the thought of going to chemo, and we wanted to kind of open this up to anybody who's been in this position, who had to make that decision of whether to go to chemo or not, because Mike's interested in quality of life, and he's a little afraid that the chemo is going to, put him in a tailspin, and yet he doesn't have too many other options. So I'd like to hear from people who've been on chemo, whether you've got soft tissue or not, but what your experience was, and kind of let Mike know, and give him some cheery advice here.
Anybody on the call? How about Jim Harrington, who wrestled with whether to do chemo or not for a long time?
Yeah, Ray, it's Jim. Well, I just started my chemo, docetaxel. So it's only been a week, and I haven't added carboplatin to it because it was already decided before I started it. And, so many people on the call have talked about it. In my opinion, and those of others who have been through it and say that while it wasn't pleasant to go through it, they do it again. I don't know how many weeks of docetaxel. Basically, I can tell you that my cancer has progressed to the liver and to the lungs to a certain small extent, but nevertheless there. And I have bone metastasis and so forth. But the path I'm taking from the Cancer Institute in New Jersey is the only option open. And so, in my opinion, do it. Docetaxel is one of the more tolerated ones. The only thing I've been experiencing is a little bit of stomach pain and the fatigue and so forth, but it's not so bad. And I haven't lost my hair either, so far. But I guess I looked at it as, since I got off the trial, which didn't work, there's no alternative. So I would say to Mike is, it affects your quality of life. Yeah, well, yeah, this is not pleasant, but I think the idea to think about is to come out the other end, as so many have, Steve and others who see a decrease. This is the only thing that's going to knock that cancer back, and looking at it that way. Well, you got to do it, and it's not a lot of fun. I'm not suffering very much. Docetaxel so far has been more or less kind to me. You're going to throw carboplatin in there, things could get a little worse. But I'd do it. I just don't think quality of life's one thing, but you got to do it. You got to go forward here. And it's my opinion.
How about some of the rest of you that have plunged into docetaxel or into chemotherapy? What words do you have for Mike Tamales?
This is Susan.
Go ahead. Go ahead.
Susan.
Go ahead, Susan.
Sorry, this is Susan. Ron was on cabazitaxel for over a year and felt great. It was really the best year he's had. He actually felt better on that than he did on the, what's that first thing you take when you have cancer? But it was probably his best year of the 5 years he's had cancer. Was the 1 year that he was on cabazitaxel, and had things worked out differently, he probably would have actually gotten a little more mild time out of it. I know other people have had problems with different things, but he did great on it. So I wouldn't hesitate to certainly with the cabazitaxel to give that a try.
Thank you. Anyone else?
Yeah, this is Dennis. I had docetaxel. Again, probably because I didn't have much of a choice in it either, but I started that with the ADT immediately upon my diagnosis that it was metastatic. And it could be a little bit of an up and down roller coaster ride as you're taking it for the 18 weeks. But I would say within a month or so after finishing it, most of the side effects from that are pretty much relieve themselves. So and I think it worked tremendously well for me. So I had more problems from the ADT side effects.
Mike, do you have any comments or questions you want to ask?
No, I'm just listening.
You'll have periods right after you get it that you'll find yourself into somewhat of a cycle where you start to go down after 5 days per week or so. Down meaning you know the fatigue sets in, maybe a little more stomach problems, and then you start to come out of that, and then you're good for about a week or so before you're ready for your next dose. So you're not feeling bad the whole time you're taking it, is I guess what I'm trying to say. So I was able to keep, my play golf 18 holes a couple times a week, pretty much through that. A few times where I didn't want to play, it just didn't feel up to it, but I could get that stuff done just before my dose and take the dose and then go down, get better, play golf, going for the next dose. So you can manage some of those effects.
Right now, I can't even, I can't do any kind of exercise because it makes my joints sore, my back, my hips, my shoulders, even walking, my knees. Pain has become a factor now.
Mike, this is Jim Harrington. When you go on docetaxel, for example, they give you prednisone. You take it twice a day. It's just part of the routine. And I'm not an expert on prednisone, not like Steve and others, but I can tell you one thing: it sure relieves joint pain. And I was going down the stairs and my knees were really sore. But these 5 milligrams is twice a day. And I know the doctors have said it too, and it's well known that prednisone can do these things. But I think you might want to ponder that or ask your doctor for prednisone, perhaps. I'm not giving medical advice here, but I can tell you one thing: it really helped with my joint pain. And you mentioned a lot of joint pains, but maybe just get some prednisone. And I mean, you got to be careful with that stuff. And but it's a thought. It sure worked for me.
I was reading something where if you have liver cancer, that's what's giving you the shoulder pain. So.
You mean the prednisone?
No, the actual.
Oh, I see. Yeah, I don't know. Yeah. Yeah, I can't comment on that. I can't. Unlike Rick, I can't dispense medical information. Sorry, Rick. I don't know.
Yeah, I guess, Mike, my feeling is that you've got a pretty crummy quality of life right now. And I think from what I hear is that the possibility of enhancing your quality of life is real with going on chemo. I mean, the alternative is not very good. To do nothing is not a great alternative, and it could make it even more miserable.
Yeah, I agree. It's Jim. Absolutely, I agree.
Yeah, I agree with this, Steve. I agree with.
You got to fight it. You got to go forward.
Yeah, this Steve. I absolutely agree with Peter and Jim. If you've got soft tissue metastases, liver or lungs, you really run out of other options. And you could go to carboxytaxel, Jeptana, because it's a little better tolerated than the docetaxel, or go to low dose weekly docetaxel. But I was on docetaxel for the 6 cycles about a year and a half ago, and it's not fun, but you get through it. And to me, the quality of your life isn't great right now. It's not time to give up, though. I would certainly try this, and even if you try it for 2 or 3 cycles just to see how you're doing. I wouldn't just not do it.
Okay, guys, thanks very much. We have an appointment with the doc in 2 weeks, 2 weeks from tomorrow, and I'll go with Mike, and we'll meet with him just before I go back out to the PCRI conference, and
Peter,
we'll see what he says.
Peter, one thing that I would put on the agenda for that meeting is to kick off with cabazitaxel versus docetaxel, because I think, Mike, that if you've heard it from a number of people, that you might just feel better and it might be easier on you doing the cabazitaxel first.
Yeah, we'll ask those questions. See if we can get a jump on this.
Okay, thanks, Peter. Thank you for all you're doing.
Thanks, Mike. Mike, do you have any other questions or thoughts on this?
No. Just something more to think about. Thanks for filling in the blanks. Yeah, I have no other questions. We can move along.
Okay.
I've heard some folks talking about a call that's on tomorrow night. What kind of call is tomorrow?
The call tomorrow night is a caregivers call. So anybody that is a caregiver for somebody with advanced cancer of any sort, not just prostate cancer, but if you're taking care, for example, I don't know if you're married, Neil, or if you've got a significant other, but if your significant other is being thrown by your diagnosis, then we would welcome that person on our call.
Is there a phone number or a website to go to know what phone number to access it?
The one I gave you earlier on, ancan.org.
Okay.
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 Here we go. I'm looking at the number right here. It's 646.
Right.
749.
Right.
3129.
Okay.
And the access code is 222.
Right.
583.
Right.
973.
Wait, 583.
973.
Oh, okay. And what time is it?
It is at Jake. What time is it tomorrow? 5 o'clock? 4 o'clock?
Okay.
Hold on a minute. Jake, are you there?
Let me check. Let me check. I'll get back to you. Give me a second to check on it.
Okay, I'm trying to remember. I think it's at
I'm pretty sure it's 8 o'clock tomorrow night.
5 o'clock. Thanks, Susan. Five.
Oh.
It's at 8 o'clock Eastern. 5 o'clock.
Okay.
Okay.
Okay. Thank you.
And so we welcome any significant other, anybody who's taking care of somebody and wants to talk about it and wrestling with the issues. It's good for that. That's a great call for them to be on. Okay. Eric, we've got about 10, 12 minutes. Would you like to talk?
Sure. Can you hear me?
We can hear you.
I guess be a little better. All right, so here, I'll even let you look at me. So I was in pain, and I knew something was wrong. So the pain was in my shoulders and arms. So they did an MRI of my cervical spine and found that I had a tumor in C7. So we went through radiation on that, shrink that, and it lessened the pain in my shoulder and arms, but now my back and my sides were hurting. So they had done a bone scan and a CT, and neither of those showed anything. Didn't show the C7 tumor and didn't show anything else. So they scheduled me for a full spine MRI. And the full spine MRI found that all the tumors in the spine were growing and that there was pressure directly on my spinal cord. So I've been on increasing amounts of medication. The pain gets worse every day. I have to take more medication every day. And they can't radiate because the tumor is pushing directly on the spinal cord, and they can't radiate that close to the spinal cord. So they sent me to an orthopedic oncologist, and he wouldn't do the surgery. So now they're working with UC, trying to find someone there who will do the surgery. They haven't found anyone yet. I did went ahead and they told me go ahead. I had my second dose of Xofigo today.
Okay.
Now there's a thought that it could be even the Xofigo that's causing the additional pain because the tumors are irritated by the treatment, the Xofigo treatment. So today they also put me on a second steroid. I was already taking prednisone with the Zytiga anyway, but they put me on whatever the other one's called,
dexamethasone.
That's it, dexamethasone. And so right now I'm just in a quandary. I don't know where we're going from here. You know, various things. Maybe the Xofigo will start having more effect and will shrink the tumors. Maybe they'll find a surgeon. I'm doing 30 milligrams of morphine ER 3 times a day, and then I get breakthrough pain from that. I take Oxy between 10 and 20 milligrams, depending on how bad the pain is. And that's what I'm up to now. So I don't know where it's going from here. I am continuing Zytiga, and as I said, I'm continuing the Xofigo. My PSA, I don't know what it was today. They took my PSA today. 2 weeks ago it was 30, and last week it was 25.
When did they diagnose this C7 tumor? How long ago?
Oh, about 3 months.
3 months ago?
Enough time that I, already got set up and went through. They did 5 doses of radiation on it. They did 10 the other ones, but for some reason, I guess this one was more delicate. They only did 5.
Right. The question of surgery is really, really tricky, Eric, because I've seen too many people have surgery fairly late in the course of the disease.
I can barely hear you, Rick. And then there's some interference. I hear people whispering in the background or something.
Yeah, I'm not sure. We're having a lot of problems with the GoToMeeting connection, things like today. I have had I've seen too many people who have had surgery late in the disease, and the outcome has not been what they wanted. And while I understand that it may be one way of relief, I just want you to consider it really, really carefully, especially if it's that close, because the last thing you want to be is in a wheelchair at this point in time. And that's the risk that I think that you're taking, and you've got to really consider that carefully. Paul Hobson is a good example. And Paul is not on the call tonight, but that's just one thought. So I don't know. The have you been talking to your palliative care docs?
I saw BJ about 3 weeks ago, and I'm seeing him next week.
Okay. And so he's working with you on the extended relief morphine?
Well, he agreed with it. It was actually prescribed by Dr. Dolezal, the medical oncologist in Berkeley.
Does he have any other ideas for the pain management beyond the surgery?
Just more morphine.
Just more morphine. I mean, the acceleration or the increase in pain from the Xofigo, we've definitely heard of that before. So it could well mean that was there any correlation in your mind between the timing of the Xofigo and the increase in the pain?
No, the increase in the pain started before I started the Xofigo. You know, I had my first dose was a month ago, and I've had this increased pain for, well, you know, starting more than 3 months ago when I insisted that they do an MRI of my cervical spine. So, you know, it was ongoing before I even started the Xofigo.
But is it worse?
At that point, I was on 10 milligrams twice a day.
Do you
Or
think
15 rather, 15 twice a day. I'm sorry, what?
You think it's gotten worse?
The pain?
Since you started
Absolutely.
the Xofigo, I'm just sort of trying to drill down.
Oh, since I started the Xofigo, yes, it's gotten worse since I started the Xofigo, substantially worse.
Okay. Well, I mean, Steve, you went through the Xofigo, didn't you? Didn't you have some pain as well initially with that Xofigo?
Yeah, and I'm on my second round of Xofigo now. I just, in fact, got my second. It's a long story. I think, Eric, you remember the story. I took 3 cycles and then decided to wait several months, almost a year, and now I'm doing the other 3 cycles. But there's no question in the first week or two after the first and sometimes the second injection, you do get increased bone pain. I'm experiencing more back pain myself, although it really only seems for me to last only a few days to a week or so after the injection. The other thing you might do is follow your ALK-Phos. Are they doing ALK-Phos levels on you to see if the Xofigo is working? Yeah, if the ALK-Phos is dropping, it probably means the Xofigo is having some effect on the bone metastases, and I would stay the course because your best hope is to shrink those tumors down so they're not causing nerve compression, and the Xofigo is the best hope of that right now. So if the ALK-Phos is dropping, that's a very good sign. The PSA going up doesn't mean anything when you're on Xofigo.
What's your latest ALK-Phos number? I know it was around 126. Has it gotten any lower than that?
I'm looking right now.
Okay.
It's 96.
Okay. So, you know, what I hear Steve saying from his experience, and you know, we've heard before, is that it may cause a flare up initially, but if the ALK-Phos is moving the right way, and 96 is a pretty good number, and this pain maybe starts to subside, then perhaps the Xofigo is working on all the Mets. I mean, when was the last time? Have you been scanned since you started the Xofigo?
No, it's only been a month.
Right. So, you know, a lot of what you just told us was what we knew about you before you started the Xofigo. And while it's uncomfortable, or worse than that, I don't want to understate it, it's miserable and it's painful. It may be that the Xofigo is actually doing something for you. And before you plunge into surgery because you're wondering what to do next and you don't know where to turn, you've got to give that Xofigo a little bit of time to try and do its job, because maybe it'll turn some of this around. Anybody else want to add to that? Who else has done Xofigo on the call?
Rick, this is Len. I haven't had Xofigo, but I just wanted to say to Eric to consider medical marijuana, because there's plenty of evidence that it reduces the need for opiates to manage pain, as well as manage nausea associated with taking opiates.
Right.
Have you looked into that?
Yeah, are you?
Yeah, I have some actually. I took some last week. It was hard to tell if I did anything or not. I've got it in edibles.
Right.
And it's just CBD only.
Right.
Actually, there's a little bit of THC, and the folklore is that a little bit of THC is needed to help activate the CBD.
Right. But do you have an inhaler?
An inhaler?
A vape pen?
Yes.
Vaporizer.
Yes, I do. I have a vape, but anything with much THC in it gives me a severe headache.
Okay. Well, the grass that you've got right now, the actual grass, not the edibles, is that heavy in THC or not?
Yes.
Okay. So why don't pop down to Oakland, whatever it's called. I mean, they've got the biggest selection in the country down there. Run down there and see if you can get yourself something that's got very little THC and a significant amount of CBD, and see if it'll give you any relief. A good suggestion, guy.
Yeah, that's a good idea.
It is a great idea. Go ahead.
And this is Susan again. What Ron was having, a similar pain, and the one thing that the pain guy did was to put him on gabapentin, or Neurontin's the other name. He said, it helps the nerve pain, and it also helps, as I understood it, potentiate make your other pain medications more effective. So that's another possible consideration to discuss with your pain guy.
Yeah, they put me on gabapentin, and I had terrible side effects.
Oh, jeez.
Okay. But there is another one, and I forget what it's called. I do remember that, Eric, but I think there's something else like Neurontin, gabapentin that might be an alternative to that. That's something worth asking BJ about. He would know whether there's another drug that does the same thing but works in a different way.
You talking about Lyrica, Rick? Lyrica?
Could have been.
Yeah, probably.
How does Lyrica work, Steve?
I'm not, a mechanism of action is different than Neurontin. I don't know. I mean, it's used for diabetic nerve pain, specifically neuropathy. I've never heard that it potentiates other medications like Susan was saying. So I don't know. Again, Eric, I think your palliative care doc would know a lot more than us about how to manage pain.
Yeah.
So,
what's the generic name for Lyrica, Steve?
Lyrica. I don't know. Let me Google it. I forget.
Okay, don't worry. But look, there's a couple of things there. One, please give the Xofigo a chance. Two, please don't rush into surgery. Three, talk to BJ about drugs that might boost some of the other meds. And four, think about trying to get some medical marijuana that's heavily weighted towards CBD that might give you some relief. But, I do know that men who have complained about Xofigo, once it's kicked in and started doing its work, they found that it does ease the pain.
Yeah, that was my experience the last time I took it. The first cycle was the worst, and then it just got better and better after I only did 3 cycles. But it was my experience that the first cycle worsened the pain, and then it did get better.
Okay. Yeah, that's been my opinion, to avoid the back surgery. So, yeah, my observation of back surgery is that less than half the time it is effective, and about a quarter of the time it's very negative.
Right.
Yeah, I doubt that you're going to find an orthopedist that's going to be willing to do the surgery anyway, with what you're describing.
You see, one of the reasons it's difficult is because your bones are compromised somewhat by the cancer, so it makes it really, really tricky. And so, you know, what might be a regular operation for somebody that had healthy bones becomes really difficult. And, you know, that's what happened with Jerry as well. So give that Xofigo time to work. I mean, I think you've heard it from the guys on the call and from your docs that it could be the radium 223, and you know, maybe we'll talk to you next week and you'll be telling us, you know, I feel way better. I'm hoping.
Yeah.
All right.
Yeah, we're all hoping that.
Okay, well, thanks everybody for your help, and I think it's good advice. I'll be looking into all of this.
And reach out to me during the week or any time, Eric. Just reach out to me, or you know, there are other guys on the call you can reach out to, but talk to us. Okay.
Okay.
We're here.
Take care.
Okay. That's it. We're a bit 5 minutes over. The recording is going to be a little difficult again because I had to cut out and come back on, and then I forgot to start the recording again right away. So I think we missed the sections with Dennis Correa and with Susan, unfortunately, because they were good sections and you know they would help people. But having said that, we'll get the recordings up as quickly as we can. As we've said, there's a caregivers meeting tomorrow, and then next Tuesday, even though it's the 5th Tuesday in the month, we will have our second meeting. And then once we're through August, we'll be back onto our regular first and third Mondays, second and fourth Tuesdays. We don't have 5 Mondays or 5 Tuesdays in either of those months. The last thing I just want to remind everybody is don't forget Mark Moyad, who is going to be speaking to us at 7:30 Central Time, 5:30 Pacific Time on Thursday. He is, by all accounts, a spectacular speaker. If any of you have been to PCRI, you will have heard him. He's got a great sense of humor. He's a lot of fun. He is a professor in the Cancer Center at the University of Michigan. And he is an expert on integrative medicine. He's an expert on prostate cancer. If you've got any questions for him, I've already gotten one question from one of us here. But if anybody has questions, send them to me, because we won't be able. The questions will all be asked either by myself or by our buddy Jim Marshall in Australia, because this is a joint deal with Australia. It's possible the room is going to be full again, just like it was for the nutrition. So if you see a sign that says the room is full, you'll just dial in. As far as I know, Moyad is not using any presentation materials, so you won't be missing anything if you join by phone. And we will record it, as long as I remember. We will record it and we will post it, but if you want to ask questions, come on live. Okay, that's it. Thank you thank you especially to Peter and to Steve tonight for helping me out with the moderation, especially when we got into trouble with GoToMeeting again. And that's it. I'll say good night to everybody.
That's-
Thank you.
Hey,
Good night.
Thank you, Rick.
good night.
Good night.
Thank you.